A tripledemic, cases of COVID-19, the flu, and RSV flooding Nebraska hospitals. 3 News Now reporter Molly Hudson shows the pain points in the state's hospital system.
Our hospitals are entering a very challenging time, and quite frankly, we need Nebraskans to help us with it.
Hospital officials say right now it's best to avoid the emergency room if possible.
If you can avoid going to the emergency room and seek care at other sites, as Dr. Ward has indicated, you should do that.
Hospitals across the state are citing staffing as one of the challenges and a lack of bed space.
We'll tell you our workforce remains tired. They've been through a long number of years. We still have some openings. We still use travelers.
Emergency department visits for RSV and flu-like illnesses are up this year compared to this time last year. For the week ending on December 3rd, Nebraska Department of Health and Human Services reported 220 for RSV, over 13 for influenza, and for COVID-19, it's lower than last year, but still over 1,000.
What we're seeing currently is a earlier onset flu season with presumptively more cases because of the lack of exposure over the last couple of years.
If you or your child is sick, officials recommend you check with your healthcare provider first before heading to the emergency room.
For our youngest kids, this may be the first time they've really had a wintertime respiratory illness because we had kids very sequestered for the last couple of years at home during the pandemic.
And if the season continues as busy as it has been, some medication may be harder to find.
For example, Tamiflu, a very commonly used drug for influenza. We could be short on that down the road if we keep having the numbers we're having.
As we continue into winter and the flu season, doctors agree.
We will all be there for the patients.